Good afternoon, ladies and gentlemen. Welcome to Season Wire, the platform where we speak truth to power. You're watching Season Wire, the platform where we speak truth to power. What I'd like you all to do, first of all, as you join us, is to please subscribe to Season Wire on YouTube. Hit the notification button, give us a thumbs up, help us reach more people. We are really grateful for your support. 1 second. Okay. Welcome on board once again. Here is Lawal, Yusuf. Lawal, some Kaduna State nominee Lawal slumps during a screening speech. Quite peculiar. We hope he's okay. But it leads to further questions. What processes are in place for when somebody slumps? And do they do drills about those kind of processes in the National Assembly? And what does that speak to in terms of the healthcare of the nation? Very interesting point to raise here. Let's listen and watch this. Then we can come and talk about it. Here we go.
Distinguished actors,
one moment, he's reeling out his vision for the Ministry of Environment, and the next moment, he slumps during a ministerial screening exercise on Wednesday.
I have participated in various professional development programs, including the general management courses, and also I have worked directly in areas of visibility and in areas of environmental protection.
So just watch. This is the thing.
Members of the National Assembly security team and staff spring into action, trying to revive Mr. Balarabe Lawal, the ministerial nominee from Kaduna State.
Okay.
The Senate President takes charge of the situation, immediately calling for a closed-door session. Guests, staff, aides of lawmakers and journalists wait outside the Senate chamber for news about the condition of Mr. Lawal. Less than an hour later, the closed-door session ends, and we learn that efforts are ongoing to revive the nominee. Mr. Balarabe Lawal is eventually revived, and he speaks to journalists.
I'm all right now. I've been treated, and I'm all right now. It's basically exhaustion.
Back inside the Senate chamber, the screening exercise continues, and the final nominee, Mr. Ayodele Olawande, appears before the Senate and speaks on the areas he would focus on should he be confirmed and sent to oversee the Ministry of Youths.
It is time for us to go back. In as much as a politician, we can go to the roots and corners of this country to campaign. It is time for us to go back to the schools. Train them, talk to them, let them feel the government, let them see the government, and let them touch the government.
Earlier, the Senate screened Dr. Jamila Ibrahim from Kwara State. Although lawmakers agreed not to question her, she spoke briefly on new ways of engaging young people and harnessing their talents.
I hope to use my office to positively influence Nigerian youth to have a voice at the decision-making table. And when we're designing our youth development plan, we hope to bring young people to the table so we can have an all-inclusive plan that profiles a bottom-up approach in order for young Nigerians to take ownership of the youth development plan and its implementation.
The Senate proceeds to confirm the three nominees.
Okay, so anyway, the thing I want to go back to is this place here. I wanted to go to this place here where he's talking and then they suddenly, they're trying to lift him up and all of that. That's where I want to go. What systems do they do drills? In the UK here, many people who are UK residents, like myself, will be able to confirm this. There is something called, there's always a section whereby they actually have standby hospitals and things, not hospitals, hospital staff. And they are there to monitor and deal with situations like this at short notice. That is something that I think may be worth us, actually, excuse me, please. That is something that may be worth actually looking into. What kind of procedures do they have in place? so that the members of don't necessarily have to get involved. Yes, of course they are concerned, but there should be a system in place that is always close to hand to be able to attend to this kind of things. Glad that he's okay, but what does that say in terms of our own healthcare? And if people are just scrambling and not really having a clear plan, the question is, do we have a clear plan for if somebody suddenly has a medical issue in our nation? What is that plan? How effective is that plan? These are things we should be asking about, because if it happens on the floor of the house and they clear it for an hour and all of that stuff, in the UK this wouldn't take an hour. They may pause it for a while. They may they make a decision, but the people, the qualified staff, medical staff, will be on hand. There should be a medical team close to that, be in and around that chamber to make sure that anything happens, people are attended to. And this also should be replicated across the entire nation. That is my take on it. I hope he's fine. I'm glad he's okay. He did come out and talk. Let's just see where he spoke. He did come out and talk. And, I don't really necessarily want to talk about what others think and all of that. I just want to talk about, I want to just see how he came out. Let's hear how he spoke.
Wait outside the Senate chamber for news about the condition of Mr. Lawal. Less than an hour later, the closed-door session ends, and we learn that efforts are ongoing to revive the nominee.
So less than an hour later. Now,
Mr. Balarabe Lawal.
So, just for the purposes of being clear, he's slumped, he's up, he's talking, it's great. But the question is, do we have a system in place to deal with such situation? And if that system is in place, is it in place in all our areas of walks of life in the public, certainly in the public sector? And are there such plans in place in the private businesses across the nation, schools, etc.? That's the question we're asking now. So we are glad that he's okay. We're glad that he's recovered, but it is important to raise that point. And this emphasizes why we've been talking about the need for us to have a functioning healthcare service, fully staffed, fully equipped. These are kind of things that you would need. Thankfully, you see him, he's up and about. We're not here to castigate. We really want to make sure that we have systems in place that will cater for the lives of the people. I believe there's a section in the Constitution that actually talks about that in terms of providing healthcare. Let me just quickly show you that as well. Yes, so section 17, subsection 3, D. It states, the state shall direct its policy towards ensuring that, listen, there are adequate medical and health facilities for all persons. Now, it didn't look obvious that there were medical facilities and health in that chamber. It was people doing things on themselves. There wasn't a plan in place. At least it wasn't evident. And one of the things is, if those plans are going to be in place there, it should be replicated across the whole country. So that speaks to that. We are glad that Mr. Lawal has recovered and he spoke. We're glad. But it really emphasizes the need for us to really question our governance and really remind them that the state shall direct its policy towards ensuring that there are adequate medical and health facilities for all persons. So that is again part of the Constitution. In all of this, we are trying to make sure people are aware. And I'm actually going to do a program about in Yoruba. So people know that the state actually they must provide, because it says so. And people need to be able to refer to this in the Constitution. Of course, it's, like I said, section 17, it states there, you can see it. The social order is founded on ideals of freedom, equality, and justice. And on that, subsection 3, it states, there are adequate. The state shall direct its policy towards ensuring that there are adequate medical health facilities for all persons. So we are pleased to know that the guy, Mr. Lawal, has, he's recovered and is passed through the screening process and all of that. But the bigger issue remains. It emphasizes and highlights the lack of coordinated medical health care in place on ground, even in the government as we speak. And that can be a concern. It could have been something worse, and he may have just died in the process. Do we have a system in place to deal with that? Is the question I'm asking. And it's a fair question to ask. So, ladies and gentlemen, how do you see this? It was something to really talk about from that point of view. And it speaks to our lack of coordinated and integrated healthcare service, even though the Constitution says that the state shall direct its policy towards ensuring that there are medical and health facilities for all persons. Again, this emphasizes the need for us to actually have all of this translated into our local languages. I'm going to do this program in Yoruba and highlight this in for people to know in our local languages, so that again that empowers people to say, no, our government should be providing this. This is what it states in the Constitution, so that people can begin to hold those they elect into office to account. So I hope you found this useful. What are your thoughts on it? You are, of course, watching Citizen AY, the platform where we speak truth to power. Once again, I reiterate, Mr. Lawal is fine, and it's okay. But is the process in place? Not only at the federal, at the government level, at state level, local level, do we have healthcare in place? And are they functioning? And how often are they carrying out drills to make sure that it's effective, it's timely, and that kind of thing? And is this something that is part of the procedure on day-to-day basis? These are valid questions that we should be asking, because keep in mind, like I said, Section 14, subsection 3 states, the state shall direct its policy towards ensuring that there are adequate medical and health facilities for all persons. So, yeah, please, I don't know what your thoughts are. I'm glad he's recovered, obviously. But, let's have your thoughts. You are, of course, watching Citizen AY, the platform where we speak to the power. When you get this message, please share, subscribe, hit the notification button, give us thumbs up. Let me just show you how to go ahead and help us grow the platform. Subscribe to Citizen AY, hit the notification button, give us a thumbs up, and help us grow the platform. We are, once again, truly grateful to each and every one of you that are subscribing. The numbers are growing on a daily basis, and we are thankful for each and every one of you that are subscribing. We are still, we are inching there towards the 3,000 subscribers mark. Help us push through that barrier and even beyond. We are absolutely certain, I'm certain, and we have no doubt on this platform, Citizen AY, the platform where we speak to truth to power, we have no doubt that with your support, we will actually end up with more subscribers, sharing this important information that we have, and enlightening our people collectively together and reach more people. So that's why we are saying to you, thank you so much, and please continue to share our broadcast, because the kind of information that we're sharing is to enlighten our people to know the powers we possess as citizens and how to use those powers. So, ladies and gentlemen, you are, of course, watching Citizen AY, the platform where we speak truth to power. Before I go, let me just read the section again. I always take the opportunity to read this section to people so we know. We need to know as citizens that sovereignty belongs to the people of Nigeria, from whom the government, through this constitution, derives all its powers and authority. And then, of course, how to use those powers is through 14.2c. The participation by the people in the government shall be ensured in accordance with the provisions of this constitution. Give me 1 second, I'll just show you the picture again, and then we'll wrap it up. Yes, so just to reiterate, our role and our plan here is very simple. We want our people to be aware of their constitutional powers and how to use it, and it ties into what you saw earlier on with the person, the ministerial nominee collapsing. We are justified to ask questions about healthcare, such as I've just posed just now, and the powers that gives us that right is what you're seeing on the screen. It states sovereignty belongs to the people of Nigeria, from whom the government, through this constitution, derives all its powers and authority. And then how to use that power is, of course, Section 14.2c. The participation by the people in their government shall be ensured in accordance with the provisions of this constitution. And one of the central provisions is, of course, that we are the sovereigns. And as sovereigns, we have the right to question, hold our governors together, and indeed ensure that they do what we need as citizens, i.e. provide healthcare services. We have that power. We are trying to encourage you to use it. So, ladies and gentlemen, I hope you found this useful. Of course, this is again to deepen this awareness. We always and we continue to encourage the government to ensure that the constitution is translated into all our local languages so that the people can be part of the process. As it currently stands, our people are not part of the process because it doesn't. Many people in the villages and the towns, they don't speak English. So when you show them the constitution, they don't know what it means. But if it's in their language, they can be more. They are being brought into the government process because that's their right as sovereigns, and that is why it is so important. The drive that we're going on to raise the awareness through translating of the constitution into our local languages. You've been watching Citizen AY, the platform where we speak truth to power. Help us share this broadcast, and if it resonates with you, please do let as many people as possible know, and of course help us grow the platform. We are really grateful for those of you that have been subscribing and helping us grow Citizen AY, the platform where we speak truth to power. We are grateful for your time, your effort, and your commitment. Help us grow the channel. We welcome super chats. We welcome any, we have our accounts if you want to help us, because we do a lot of research. One of the things we want to do, we don't want to wait for the government to translate the document. We want to translate it. So please, certainly for the Yoruba side of things, we are doing that translation because that's the language we understand. And we are hoping that we can get that out at some point. Or better yet, even better still, if the government can actually translate it, because that would actually help the people to be part and parcel of the governance and be able to question and hold the governance to account. That our participation is key. Having it in English actually restricts the participation of the people who are in the towns and the villages. So, ladies and gentlemen, I hope you find this beneficial. You are, of course, watching Citizen AY, the platform where we speak truth to power. I'll back later on. Please share this broadcast if it resonates with you. Do you agree with us that the National Assembly and other places, they should have designated medical team ready at short notice in case something happens to actually attend to members of the National Assembly or guests or whoever. And also, by implication, that should be a practice that is rolled out across the whole country so that our people are given the best chance of surviving any medical issue at short notice. Ladies and gentlemen, you're watching Citizen AY, the platform where we speak truth to power. I hope you find this beneficial. Please do share. Hit the notification button, give us a thumbs up, and of course, help us share and leave a comment. Thank you once again. Back real soon. Thank you, and bye for now.